Hello, friends. As a part of this Snippet series in newer antifungals, so I've covered quite a few newer ones like Olorofim, Ibrexafungal, and Phosphenogapics, Risafungin. So I've covered all this in the previous few snippets. So the last bit that's left is Opelconazole, very simple one, but little uniquely different. And along with this, I will just make a mention of Encochleated Amphotericin-B. That's also a new molecule, which I had asked that question as a part of the quiz in the National Critical Care Conference that was held in Kochi. So these are the two last ones. So the ones I had covered was first Menogapix, which was very interesting molecule. Then we covered Rizafungin, Ibraxofungerp, and Olorofim. And this Opelconazole is the last one I'll be covering along with N-cochleated amphotericin B. So Opelconazole, which is also called PC945, is a triazole. The interesting bit, which I'm covering at the end, is mainly used or positioned as an inhalational drug because of its ability to attain very high concentration in the lung, and the systemic concentration is very low. So, which means to say it has a great topical action more so in the lung. So, positioned predominantly against aspergillus, which affects the lungs, I assume. So it has a very good concentration in the lungs, and it has a quite a low plasma concentration, which gives it that little unique advantage in positioning it against aspergillus affecting the lungs. And it has been considered or suggested to be used as prophylaxis in non-neutropenic patients. And the spectrum of activity is in Candida auris, which is also a problematic drug that we tend to see in ICU. But as I said, this is right now being sort of positioned more for inhalational. So I'm not sure how much benefit it would confer for Candida auris systemic infection. It may not. So mainly, I would say right now, as this drug is evolving, it seems to be positioned more against the aspergillus in the lungs, and that tends to affect more lungs. And they have looked at potency, and that's the interesting bit in aspergillus. Its potency is 2.5 times more than the voriconazole because the only drug of choice for aspergillus at this point of time is voriconazole, and the second choice is amphotericin. So this has 2.5 times more potency with very less side effects because it is used as inhalational, and its efficacy is found to be equal to posaconazole in the initial studies. And it doesn't seem to have, since the very low plasma concentrations are attained, drug to drug interactions is found to be very low. And if you look at the side effects, they are very run of the mill sort of a drug side effects like nausea, vomiting. So it's mild to moderate, and some throat constriction, fatigue, and cough. So this, because it is inhalational, so we would expect some bronchospasm and cough, and throat constriction is something that has been found. So which is mild to moderate. So a very interesting drug, more as an inhalational, may have a good role to play in prophylaxis against aspergillus and even for treatment as the potency is 2.5 times higher. So just a last mention. So I've covered pretty much all the newer antifungals or all the DRNB candidates for whom this question was asked. You only have to mention these ones which I have mentioned already. So the last one in the last kid in the block is nanocochleated or encochleated amphotericin B. Very interesting concept. So what they have found is they have wrapped this amphotericin B in the sort of the lipid moiety and phospholipid inositol. So it is being wrapped. So as you see in the picture, it is wrapped, and then it delivers. The drug is delivered once this wrapped sort of a drug or the nanoparticles, if you have to call it, enters the macrophage and then releases the drug. So it is being currently marketed by Matinas Biopharma as a MAT 2203. And the phase 2 trials are already done, which is found to be very safe, especially in cryptococcal meningitis and skin infections and soft tissue infections. So as of now, phase 2 trials have been approved, and now it has entered phase 3 trials. So this is a molecule for us to keep an eye on. So right now we have liposomal amphotericin B, and we have amphotericin B colloidal dispersion. So this is a new sort of a molecule we could look forward. And if you look very interestingly, pay little attention to this picture. So this is the drug. The violet ones are the drug molecules which are sort of embedded in the phosphatidyl sulfate bilayer. So it is sort of put in this phosphatidyl serine bilayer, and once this particular drug, which is embedded in the phosphatidylserine bilayer, enters from the high calcium concentration from the plasma to the low concentration one present in the low calcium presence in the macrophages. This gradient of high calcium to low calcium leads to release of this active component of amphotericin B from the phosphatidylserine sort of a moiety, and causes the fungicidal action. So the whole reason this has been evolved like this is to absolutely minimize the toxic effects of amphotericin B, because the effects are not seen in the plasma. The effects of amphotericin B happens only when it enters inside the macrophage from the high calcium environment to the low calcium environment in the macrophage. This drug gets released and acts. So very clever, so very intelligent sort of a nano particles that have created, which they have called it as encochleated amphotericin B. That's about it, folks. So the newer antifungals that I have covered is olorofim, Ibrexafungerp, Ibrexafungerp, and fosmanogepix, risafangin, and opelconazole, and N-cochleated amphotericin B. So if you write all these six molecules, I think that pretty much covers at this point of time all the newer antifungals that are there in the market. So thank you, friends. Request you all to submit your valuable work to Journal of Liquid Care. Of course, you can visit my website to rehear to this lecture. So it's a beautiful quote. At the end of the day, your big competition and your only competition, your biggest competition is only you. So you are competing against yourself, so not against anyone else. So that's a beautiful quote. So thank you, one and all.